Bayfield County has become the first law enforcement agency in Wisconsin to implement Avel eCare Crisis Care, which is a groundbreaking telemedicine service that provides 24/7 access to behavioral health professionals. And joining me now is Brian Erickson, who is the Vice President and General Manager of Behavioral Health. So, Brian, first of all, can you just explain to me how this all works?
Absolutely. And it's not too terribly new. We're just gaining some traction here too. We actually started in 2020 with a pilot state in South Dakota, and then we've grown it since then. And what it really is a virtual co-responder model for law enforcement. As we see, law enforcement officers are getting challenged with more and more activities every day outside of what they thought they signed up for, right? For law enforcement, now they're asked to be social workers and nurses and everything else. So we really want to support them because we know that even those individuals that they're seeing in a crisis, they also need the support. And we don't want the unintended activities such as handcuffing, taken to jail, taken to the emergency department when you're at your lowest time in your life probably to occur. So can we support in that manner? And we do that by responding virtually. So either it's done with an iPad or it can be a mobile device that either the officer has or maybe even the individual in crisis itself. We can connect at the request of the law enforcement officer, and we at that time we'll have a discussion with the officer to get an idea what is going on, and then we'll talk with the individual themselves in crisis. And what we do when we're having that discussion is de-escalation of the situation, creating a safety plan, determine the true level of safety and risk that they have at the moment. And also if we need to do some means restriction education, we do that as well. So the whole intent is to try to get them into a better mindset, make sure they're safe. They're going to be safe at home. And what we've found is that 80% of the time, 80% or greater of the time, we are keeping that individual at home instead of being criminalized the activity of the crisis, right? And then we also support with the community resources, whether it be a community mental health center. We work with those agencies as well. So we then tie that individual with that agency. So there's follow-up that occurs.
And what kind of situations can this service be used for?
Yeah, anytime somebody's in a crisis that law enforcement responds to, where they may be severe depression or maybe suicidal ideation, any of those situations where it's just additional support and ask for safety level.
And by having this available, what are the goals?
Well, first and foremost, the goal is safety of the individual in crisis, right? But it's also supporting law enforcement and also when we look at the healthcare situation that we have with behavioral health, they're overwhelming. We don't have enough workforce out there, right? And a lot of times there's not places for these individuals to go. So law enforcement has to go to emergency department or a jail to wait for somebody to come in, or they may have to travel several hours out of their community to go and take that individual somewhere to get that assessment, and really supporting that. So we can, maybe we can get upstream and kind of be a disruptor in how that care normally happens and do the right thing at the right time.
So, what kind of collaboration was needed between Avel and law enforcement to make this happen?
Yeah, just an understanding of when to call, when they need us, make sure they're doing that, and it's just make sure we have ability to connect, whether that be with the iPad or whether that be with a phone. We can send a link by email or SMS text, and we connect right away.
So, we are wondering if the Bayfield County in Wisconsin Sheriff's Office has put this to use yet, and if they have, if there's been any feedback.
Yeah, actually, right after going live with services, they did use it almost immediately. And an overwhelming response we got back from them that it was very helpful for them. The individual did not have to go to jail or ER in that instance. Very first time, worked just as it should.
So, do law enforcement, do they have to go through any kind of new training in order to make this work?
Sure. Well, law enforcement does a lot of training on their own already for some of the behavioral health responses. But what we do when we work with them, we take a time of implementation where we, take them through the technology because we want to make sure in some areas certain phone carrier companies work better than others. So we identify that and just do training on when to call. And other than that, it's just real simple collaboration of just working together with a common goal.
And are there any plans for other agencies to be able to use this service?
Yeah, currently we're in 155 agencies. Um, Certainly in Wisconsin per se, they were the first in Wisconsin. There was last fiscal year for Congress there, the legislators should say, they had Assembly Bill 573 that they actually allocated dollars that paid for 75% of this program for any of those law offices that wanted to use it. So Bayfield was the first to jump on board.
So, do you know if anyone in Minnesota has used it yet?
Currently, nobody in Minnesota yet. So we
We'll
are
get there.
we're surrounding. We got Nebraska, Kansas, Nevada, Wyoming, Montana, North Dakota, South Dakota. So it's starting to expand.
Well, thank you so much for joining me and telling me all about this. I appreciate it.
Thank you, Hannah. I appreciate it as well.